Hi, everybody. Welcome to week 10. This week we are talking about being student oriented. Um, Being student oriented is not the easiest thing to do. It's much easier to be faculty oriented. Takes a lot less time, but it's less effective. With being student oriented, I think first you really need to care about your student, whether that's the patient, the staff nurse, or the nursing student. You need to care that they're successful, that they get the information that they need, um, and that you're not having an attitude of weeding out the bad students. We all know nurses who are better in some things than other things, and you never know what potential a student might have as they're going through a program. I have seen some instructors who really look to be weeding out um, the students. And I'm not saying that we should pass students that aren't competent, definitely. But we need to be focused on helping our students. Okay, so being students oriented. When I think about this, when I think about preparing teaching, I try to think about how can the student best learn this content as opposed to how I can best teach this content. Okay, so I try to look back to those learning preferences, the auditory, the visual, and the kinesthetic. And so I really look at, are there ways I can incorporate those that make sense with this topic? I can't remember if I told you this already, but an example of this is when I was teaching about diabetic management. Okay, and so I had a component that was lecture, and then I had various stations set up that the students had to rotate through. They had to calculate an insulin drip. They had to look up carbs. They had to determine what the carb count was for a meal. They had to determine sliding scale dosages based on both carb counts and blood sugars. So some very hands-on things that incorporated the visual and the kinesthetic. And the audio was covered with the lecture. So just trying to look broadly. And I think the thing we need to think about with that is some people think about active learning strategies and they think it's an add-on to lecture. It shouldn't be viewed as an add-on. It should be viewed as an actual teaching activity time. And so the two should complement each other. It shouldn't be think about as an add-on. Let's see. I am attaching an article, though, on the challenges of active learning strategies. It is much easier to do a straight lecture than it is to incorporate active learning strategies. Definitely, it takes less time, it's much easier, but again, it's not as effective. And so I'm including an article on the challenges of active learning strategies because as teachers, you really are going to be expected to use those strategies if you're going to meet the student learning preferences. You're going to have to use active learning strategies. That's kind of all there is to it. But I want you to know the practical side too, what the challenges are and how we can think about ways of overcoming them. So I've attached an article on about challenges of incorporating active learning strategies in the classroom, and hopefully we can talk about that. All right, so week 10, we also have an NEPD due this week, and then week 11, test analysis paper. So I think it was last week I gave you information on standard deviation and calculating KR, things like that. I've given you information before on developing effective multiple choice test questions. So hopefully you've already given those test questions out to peers and are in the process of getting them back and then working on your paper. Remember, if you have questions, please contact me in the individual forum or questions to instructor forum, either one, because I'm sure lots of people have questions about this assignment. All right, so looking forward to a good week. I think we've got lots to talk about this week. I look forward to hearing your thoughts and also your concerns about active learning strategies and using those in the classroom. I know for some of you, this will be really pushing outside of your comfort zone, so I think we need to talk about it. All right, I'll see you in the main forum. Bye-bye.